and welcome to Radford Animal Hospital. Today we'll take you step by step through what you can expect when your dog or cat comes in for dental prophylaxis, also known as a dental cleaning. We'll be following Peppy through her journey and showing you how the process works behind the scenes. Dental health is way more than just fresh breath. It prevents and treats disease at its source rather than just addressing the symptoms. This is why we recommend dental cleanings either annually or every 6 months, depending on your pet's age, breed, and medical history. Schedule an exam with one of our wonderful veterinarians, and they can set you up with a dental plan tailored to your pet. Here are a few signs you can look for at home to see if your pet is due for a dental cleaning. Bad breath, difficult or painful chewing, excessive drooling, or visible tartar on the teeth and inflammation of the gums. If you're seeing this, it's probably time to come in for an exam. The first step to a dental cleaning is coming into the hospital, of course. After checking in with the receptionist, you will be greeted by one of our surgery technicians or team members. They will begin reviewing your pet's medical history and walk you through today's planned procedure. You'll be walked through consent forms and treatment plans. If you have any questions or there are any elective procedures you'd like to perform while your pet is with us, such as vaccines, ear cleaning, or microchipping, this is the perfect time to let us know. Now is the time to give your baby a few goodbye kisses and be assured that we will take very good care of them. We will now begin our pre-anesthetic evaluation, which includes recording your pet's current weight, taking their internal temperature, and drawing blood for pre-anesthetic lab work if this has not already been done prior to the day of surgery. The combination of these tests help us ensure that your pet's internal organs are healthy enough to undergo anesthesia. The doctor performing the surgery, in this case, Dr. Carol Hansen, will do their pre-anesthetic exam where they do a full nose-to-tail exam. Peppy has now been cleared for surgery and is just getting a few extra cuddles from Dr. Hansen before her dental adventure begins. After we administer a sedative, to help keep your pet calm and comfortable, our surgical team will shave and sanitize the area to place an IV catheter. This will allow us easy access to deliver both fluids and medications throughout the procedure. Once your pet is anesthetized, they are intubated to protect their airway and allow for monitoring. Throughout the entire procedure, a licensed veterinary technician closely monitors and records their vitals, including their heart rate, internal temperature, blood pressure, and oxygen levels. Your pet's comfort and warmth is always a priority. We use blankets and heating devices, which is especially important for our smaller patients. And an added bonus, during every anesthetic procedure at RAH, your pet receives a complimentary nail trim. Before we begin cleaning, we always take full mouth dental radiographs. These give us a complete picture of the health of the teeth below the gum line, where the majority of dental disease hides. This is where we'll catch problems like root abscesses, bone loss, or fractures that aren't visible on the surface. In Peppy's case, the radiographs show a few broken teeth that will need to be removed. Once we know your pet's full story, our technicians proceed with ultrasonic scaling of each individual tooth to remove tartar above and below the gum line. Then they polish the teeth to smooth the enamel and reduce future plaque buildup. Once the teeth are clean, imperfections are more clearly visible to the naked eye. This is when the doctor will come in to take care of issues like loose, decaying, or broken teeth. If a tooth needs to be removed, the doctor begins with a local anesthetic to block the pain. Then the tooth is carefully sectioned and removed. Dissolvable sutures are used and will usually disappear within a few weeks as the mouth heals. Once the procedure is complete, your pet is moved to our recovery area, where we monitor them closely and keep them comfortable as they wake up from anesthesia. We usually try to sneak in some cuddle time with them as well. A few hours after surgery, Peppy is awake and eager to go home. Most dental cleanings are outpatient procedures, meaning that your pet will go home the same day. So after surgery, the doctor will give you a call, let you know how everything went, and will let you know when you are able to come pick up your pet. When you arrive, a doctor or veterinary assistant will go over your pet's discharge instructions, which includes feeding recommendations, activity restrictions, and any medications prescribed by the doctor. So remember, dental disease isn't just bad breath. It can be extremely painful for your pet and lead to infections that affect their heart, liver, and kidneys. That's why addressing these problems early can make a huge difference in your pet's overall health and comfort. And a big thank you to Peppy and her family for letting us share her dental journey. And thank you to all of you who trust Radford Animal Hospital with your pet's care. If you have any questions regarding dental health or believe that your pet is due for their annual cleaning, please visit us online, in person, or over the phone. Together we can keep your pets happy, healthy, and smiling for years to come.